everyone. As the war against COVID 19 progresses and governments, scientists, health workers all explore the various ways to combat this situation, we hear a lot of new terms, prospective solutions, which are being discussed globally. All of that makes us wonder, could this be the answer to the situation? To help us understand the real situation, we have Dr. Azad Moopen, founder, chairman, and managing director of Aster Healthcare, who is connecting from us via his home from video conferencing facility. Dr. Moopen, thank you so much for your valuable time.
Thank you, Ninin.
Dr. Moopen, we are hearing a lot about herd immunity. We heard that the UK PM Boris Johnson said that one of the best ways to tackle would be to allow the population to build a herd immunity. What would be your thoughts on that?
There are a lot of confusions in the minds of people. It only means that if there is large number of people in a community who are already infected by a virus or a bacteria, and if they develop immunity against that, that will provide protection to the rest of the people. For example, 50, 60, 70, there are different numbers being given of the population getting protected. Usually this happens by immunization if you have a vaccine. And that's a very safe thing, because if you have a vaccine, you immunize 60, 70%. That means you don't have to immunize everybody. Even if it goes to a percentage, large portion of the community being immunized, the rest of the people get protection. It happens like this. If you have 5 people around you, and if many of them are already having immunity, the virus doesn't have the opportunity to spread from one person to the other. That's the way in which it works. So this provides protection to the other people who are not immunized. Same thing was being thought of, because there is no vaccine, being thought of as something which can be used, and the first country which came out with this was UK. But later they realized that this is having an issue, because when you allow people to get infected, that means there is more of chance for severe infection and even death. And that's what happened in UK. Nearly 20,000 people died, and so they have changed that whole strategy. Another country which tried this and still continuing is actually Sweden. Sweden has got much less death rates, and so they are now exposing more and more population, thinking that this will provide immunity for the large number of people and providing protection for everyone. So that is the situation in Sweden. We don't know how it is going and how it will go forward. But looking at the fact that there is no vaccination, and looking at the fact that there is more of chance for death and more of severe illness, I think that it is better to be cautious and not to test this out in most countries. And that's my view. And you have to wait for a vaccination to come, and then only you should try to increase the herd immunity and get more people under the immunized status.
Moving on, what is a field hospital? We have heard a field hospital being built in China, UK, Italy, and we just learned about a similar one being built in Dubai. Is it something that we should be worried about?
Field hospitals are ones which usually you see in wars and all. When there are war and calamities, there is a requirement for large number of either soldiers or people in a calamity, like a natural calamity, they have to be treated. We hear about field hospitals being set up. So in the situation of COVID, even though it is called field hospital, it is something which is a planned activity, and the governments have taken this precaution, because when the number of cases go up significantly, there is a surge for more of hospital beds and availability of more of space for accommodating patients. This is exactly what happened in many countries which found it extremely difficult to manage cases. For example, in Italy, in Spain, and recently in US, and it's still happening. There is a dearth of hospital beds because there are limitations in which the hospitals can accommodate patients. So in that situation, what do? You will have to set up beds and facilities for treating patients outside. And this happens not in a planned manner, in a very sometimes no, in a very unplanned and ad hoc basis in many countries, where you see large tents being set up and beds being put there. Whereas the UAE has taken the step to anticipate that and to build hospitals to accommodate these patients. So they have first started this in Dubai, where the Dubai World Trade Center, they are setting up a 3,000 bed facility, of which some beds have already been functional. Apart from that, they already have started this activity in Abu Dhabi also. Abu Dhabi, there is one field hospital coming up in Adnak facility and another one in Sheikh Mohammed bin Zayed city. So these two again will be having about 2,200 beds, and they also are now planning a second field hospital in Dubai, in the Dubai Parks, which again will have about 1,200 beds. So on the whole, we are talking about a capacity building of about 7 to 8,000 beds, which is ready for accepting patients. And these hospitals are supposed to treat not the very severe cases, but the cases which requires intermediate care, the moderate cases. So those will be extremely useful because that will decongest the hospitals. And in the hospitals, you can look after people requiring ventilation and advanced care. So it's not something to be feared about it, because the authorities of UAE have been very proactively looking at it, and they have provided this to help the people, to support the people. Whenever there is a surge, God forbid if it happens, those patients can be looked after in the field hospitals.
Dr. Moopen, it's always a pleasure to talk to you. And the way how you simplify it and you make it easy for all of us as laymen to understand this new terminology of herd immunity. Let's hope that, this trial test error method does reach to a very positive conclusion. Also, we would like to thank our UAE government and the rulers for being so ahead of time with coming up with the field hospital theory. With this, we come to the conclusion of our this segment. Thank you so much, Dr. Moopen, for being with us and for giving us your valuable time.